Okay, part 2 of hormone testing, because I rambled and I got cut off. If you hit the comment that I've left here, it'll lead you to part 1. I'm Dr. Laura Pfeiffer, naturopathic doctor, and I help you take your hormones from chaos to calm. So kind of leading off my jumping off point from my last video, we need to make sure that we're testing your hormones at a specific time in your cycle. If you are a cycling individual, meaning you get a period, then you're going to base it off of that. Day 1 is when you bleed. Day 1 is when you bleed again. Day 3 is when you're typically, especially in a fertility setting, going to look at things like estrogen, LH, FSH, progesterone, and testosterone. And usually fertility clinics will throw in like a TSH there, looking at your thyroids. Your thyroid, singular. Progesterone is day 21. Like I had said in my first video, typically what I'll do is if I have a non-fertility related patient who's just seeing me for their hormonal concerns, I'll do a day 21 estrogen and progesterone so I can get a ratio. Because what happens is if we're testing your progesterone 10 days after ovulation, 7 to 10 days after ovulation, it's typically around day 21. To make sure that's accurate, I get most of my patients to do ovulation test strips or LH strips so that they can confirm when they are about to ovulate, and then they can plan for their blood work about a week later. Then we can see that their progesterone is getting high enough, indicating good egg quality and enough progesterone to kind of sustain a pregnancy. And really, enough progesterone to sustain a pregnancy is going to give you a hormonal balance in that second half of the cycle. So looking at it from a number of ways. Here's the thing. If you get your blood work done at any time in the cycle and you have a period, I'm going to look at your blood work and I'm going to see the reference range. Now here in Ontario, just to give you an example, Life Labs here breaks it down and they look at estrogen in different phases of the menstrual cycle, including menopause. And so when you're looking at the reference ranges, it's going to be anywhere from like less than 40 to I think it's upwards of 2,000 and something, almost 3,000. My point being, if we don't know where you're going in the cycle, it breaks it down by phase. We're not going to know, like if it's anywhere from less than 40 to almost 3,000, you're technically normal. But that doesn't make any sense. So having context to your hormonal blood work is really important as well. This is why when I do a day 21 progesterone, I'll also tack on an estrogen so I can see how they're working together. Sometimes my patients are ovulating and it looks really great, but their estrogen is going so high that I'm like, no wonder you have PMS and acne and things like that. If you are in perimenopause, it can be a bit more difficult. So I'll get you to do ovulation test strips. And if we can't find an ovulation in like a 2-month period, I'll just say go whenever you can. And if you're in post-menopause, obviously you're not getting a period, you can go for your hormones whenever.